Bismillah ar-Rahman ar-Rahim. Honorable Chief Guest, President, Pakistan Medical Commission, Professor Dr. Ashar Taqi, Chancellor, Rifa International University, Mr. Hassan Muhammad Khan, Vice Chancellor, Rifa International University, Professor Dr. Anis Ahmed, Guest of Honors, Major General Retired Masoodur Rahman Kiani, and Professor Dr. Shehzad Ali Khan, Worthy Principal, Lieutenant General Retired Azhar Rashid, General Wasim Alamgir, Executive Director, Rifa University, Mr. Asadullah Khan, Director, Rifa Institute of Lifestyle Medicine, Dr. Shagufta Feroz, Vice Principal, Brigadier Retired Maqsood Al Hassan, dignitaries, deans and directors, head of departments, faculty members, delegates of conference, distinguished guests, and dear students. Assalamu alaikum, and a very warm welcome to you all on the first and the foremost International Lifestyle Medicine Conference 2021. On behalf of Rifa Institute of Lifestyle Medicine, I, Dr. Aisha Mohan, MPhil Postgraduate Trainee in Physiology Department in Islamic International Medical College, feels great pleasure and honor this fresh and glorious morning to welcome you to this auspicious occasion organized by Pakistan Association of Lifestyle Medicine, known as PALM, in collaboration with Rifa Institute of Lifestyle Medicine. And the theme is the role of lifestyle medicine in immunity enhancement. August gathering, I assure that this program shall be full of exuberance and exaltation and will create some beautiful memories to cherish. To begin with, I would like to quote a beautiful translation of a verse from the Holy Quran. He is Allah, the creator, the inventor, the fashioner. To him belongs the best names. Whatever is in heaven and earth is exalting him, and he is the exalted in might, the wise. I would like to call upon Hafiz Huzaifa Hani, final year MBBS student of Islamic International Medical College, to recite few verses from Holy Quran. Hafiz Huzaifa.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم يا أيها الذين آمنوا كلوا من طيبات ما رزقناكم واشكروا لله إن كنتم إياه تعبدون إنما حرم عليكم الميتة والدم ولحم الخنزير وما أهل به لغير الله فمن اغتر غير باغ ولا عاد فلا إثم عليه إن الله غفور رحيم. Believers, eat of the pure things wherewith we have provided you for sustenance, and give thanks to Allah if it is Him that you serve. He has made unlawful to you only carrion and blood, and the flesh of swine, and that over which there has been pronounced the name of anyone other than Allah's. But he who is constrained, and he neither covets them nor exceeds the indispensable limit, incurs no sin. Allah is all forgiving, all compassionate. Al-Baqarah. Sadaqallahul Azim.
We all have experienced an unprecedented situation with global COVID-19 pandemic. What is important though is that the momentum to promote the cause to educate and facilitate people through this platform is still intact. And we are obliged to all of you to spare your precious time to grace this occasion. May I now request the prestigious guests of honors to kindly come on stage and resume your seats. Major General Retired Masoodur Rahman Kiani and Sir Professor Dr. Shehzad Ali Khan. I now request the Vice Chancellor, the Chancellor, and the Honorable Chief Guests to also come on the stage and resume your seats to formally begin the inaugural sessions. Thank you very much, sir. So may I have the permission to start the proceedings, please? Grateful, sir. Ladies and gentlemen, I would like to invite the founder and president of Pakistan Association Lifestyle Medicine, Director, Rifa Institute of Lifestyle Medicine, Council Member, Global Positive Health Institute, Professor, Health Services Academy, Visiting Faculty, Civilian Staff College, founder of Synchronized Lifestyle Modification Program, and author of the book, Living as Nature Intended. The lady with the charismatic personality. Please welcome Dr. Shagufta Feroz.
Bismillahirrahmanirrahim. Assalamu alaikum. I welcome you all from the core of my heart to this first international conference in collaboration with Pakistan Institute of Lifestyle Medicine and Rifa Institute of Lifestyle Medicine. And I'm sure when the conference is going to finish, every one of you is going to learn something which is going to resonate with your own life. So let me avail this opportunity to share with you few facts about lifestyle medicine, because it is a new specialty, and most of the doctors, I would say, they don't have the clarity. Let me clarify categorically that lifestyle medicine is a new specialty. It is an evolved version of a medical science. And it started in America about 17, 18 years before. Then it has got certain specific characteristics, like it focuses on self-care, it focuses on physician burnout, and it focuses on the disease reversal. This is the specific characteristic of the lifestyle medicine itself. Now, it is a movement. So what are the characteristics of the movement also? Movement is global. So when I landed into lifestyle medicine, I was supposed to start a society or organization in Pakistan if I was really passionate about lifestyle medicine. So the characteristics of the movement are that the countries globally, they have to start an organization. And we have to function under the umbrella of American College of Lifestyle Medicine, which is supported by Harvard Medical School or Harvard University, which is supported by Stanford, which is supported by Loma Linda University. Then we are supposed to go and attend the conferences. So we all are on the same page. Then they have started American Board of Lifestyle Medicine. And the founders thought that it would be an injustice that if they are not going to educate the healthcare team from the other countries. So they started the International Board of Lifestyle Medicine, and the first exam was held in 2017. I appeared in that first exam, though I couldn't pass that exam because it was a new concept for me. So the second demand which they expect from the organizations in the country is that a country should be organized enough that they can hold the International Board of Lifestyle Medicine in their country. And we are blessed, the PALM is blessed that we are going to organize our first International Board of Lifestyle Medicine in Pakistan. So this is just the simple few facts. And let me clarify to all those, as the lifestyle medicine is gaining little momentum in Pakistan, individuals or organizations, they have started approaching American bodies or American college or American board, because they are showing their interest to establish lifestyle medicine in Pakistan. I wanted to clarify them that lifestyle medicine is promoting global unity, and they don't like any division in a country. So what happens if some country, there are multiple leaders of lifestyle medicine, they just kick that country out of the global alliance. So we, as Pakistan Association of Lifestyle Medicine, we are member of Lifestyle Medicine Global Alliance also. And these were the prerequisites These were the prerequisites to organize this first exam in Pakistan. So I would like to request all of you, all the organizations, institutes, to please come and join with us so that we can help this ailing humanity, or we can lessen the burden on our medical hospitals or colleges also, and we can educate our medical students in a better way. Before ending my session, I would like to tell you how I landed into lifestyle medicine. Whenever this national anthem is played, I don't know, but I have goosebumps. I have goosebumps. मुझे तराना हमेशा मेरे रोंगटे खड़े करता है. But I never knew that वतन की मोहब्बत is there in the DNA. And I learned this through my journey of lifestyle medicine. Harvard University was my dream university, and I always wanted to do something, but in my private capacity, I was not able to join that Harvard Medical School. So in 2011, they announced a certification in lifestyle medicine. So I thought, and I make fun of lifestyle medicine, by the way. I thought, what is this lifestyle medicine? Like my fellow colleagues are doing at the moment also. I thought what the Harvard Medical School is doing, they are talking about lifestyle medicine, but मेरा जो लालच था वो Harvard University जाने का था. So finally I landed into that medical school and I started attending that certification course, which was a short course for probably 1 week. हमारा introduction वहाँ पर हो रहा था. So the administrators, directors, and the professors they very proudly introduced the delegates, the foreign delegates, and they took the name of about 7 delegates from 7 countries, and they didn't mention my name. मुझे एक अंदर से गुस्सा सा चढ़ा ना, और मैंने जोर से कहा पाकिस्तान, you didn't mention पाकिस्तान. उन्होंने मुझे जरा गुस्से से देखा, और ये वो टाइम था जब पाकिस्तान में बॉम्ब ब्लास्ट हो रहे थे, 2012-13 की बात है. तो मैंने दिल में सोचा कि ओहो, ये तो मेरी ड्रीम यूनिवर्सिटी थी, लेकिन बड़े मुतासिब लोग हैं ये. उसके बाद कोई 2-3 घंटे के बाद फिर दोबारा कोई मेंशन हुआ कि जी इसमें इंटरनेशनल डेलीगेट हैं. तो कोई जो दूसरे कंसल्टेंट थे वो स्टेज पे थे, उन्होंने फिर कहा कि वी हैव डेलीगेट्स फ्रॉम 7 कंट्रीज बट दे डिडंट मेंशन पाकिस्तान. देन आई स्टूड, मैं खड़ी हो गई और मैंने हाथ ऊंचा किया और मैंने कहा जी आई एम फ्रॉम पाकिस्तान. Then he said, okay, yeah, she is from Pakistan. This course was over and I came back to Pakistan with a very heavy heart. मैंने सोचा कि लाइफस्टाइल तो बहुत ही कोई फजूल सी चीज है और ये तो सिलेक्टिव लोगों को पढ़ाने लगे हैं, तो मैं तो इसके अंदर कोई काम शाम आगे नहीं करूंगी. I came back after 2 weeks. After 2 weeks, I got an email from this institute, which is Institute of Lifestyle Medicine attached to Harvard Medical School. और उन्होंने मुझे ये कहा कि हमने तुम्हें अपना LMed collaborator ले लिया है. When I read that email, I could not absorb or digest or comprehend. ये क्या कह रहे हैं? ये कैसे हो सकता है कि हार्वर्ड मेडिकल स्कूल मुझे अकेले को ले रहा है LMed collaborator? मैंने उनको वापस ईमेल किया कि probably there is some mistake is done. I'm not the one. You wanted to send this email to someone else. उन्होंने कहा नहीं नहीं, हमने आप ही को भेजा है, and one of our directors is going to organize Zoom meetings and they will train you how you will be acting as an LMed collaborator. And believe me, I worked with them for 4 years, and that was the time then I decided, okay, there is something about lifestyle medicine. And then I changed my all perspective about I opened my narrow mind, and then I started working on lifestyle medicine. So I'm sure you will attend this conference with an open mind and open heart, and you will enjoy the next 2 days of our heavily loaded scientific sessions. So best wishes for you for attending this conference. Thank you very much.
Thank you very much, ma'am, for your kind words. The University of Arizona is a public land-grant research university in Tucson, Arizona. Excuse me, please. Founded in 1885 by the 13th Arizona Territorial Legislature, It was the first university in the Arizona territory. Let's take a video message from Stephanie Federer, Senior Director of Business Development, Andrew Weil Center for the Integrative Medicine from University of Arizona.
Everyone, my name is Stephanie Fader, and I am the Senior Business Development Director for the Andrew Weil Center for Integrative Medicine. Thank you so much for having us. We wanted to offer everyone in attendance a free course from the Andrew Weil Center. Environmental Health, an Integrative Approach, looks at the foundation of integrative medicine as it pertains to the environment around us. You will be able within this course to unlock information on how to better your lives and what things to look out for in your own environment to further assist you in living a healthier life, as well as give back to your patients. You can go to the link here that you see, bit.ly/3CGIE20 to go to that course, or you can check out any of our other online courses at awsim.arizona.edu and use the promo code in front of you for any of our standalone courses at a 20% discount. The Andrew Weil Center was created in 1994. Andrew Weil was on a road trip traveling from the East Coast and got a flat tire in Tucson, Arizona, and thought its beauty was so grand and that the feeling of wellness was so alive in the desert that he actually decided to stay, cut his road trip short after getting that flat tire, and really developed a home base here in Arizona. During that time, he developed the Fellowship for Integrative Medicine along with our center and the University of Arizona. At first, it was only 4 people we were training per year. We are now up to over 85 per year per class, and there are 2 classes a year. So we're training over 170 or so physicians in the Fellowship of Integrative Medicine. Our online education is a really great place for you to improve your knowledge. There's a built-in community, and we've trained thousands of professionals in the healing-oriented practice of integrated medicine. You will see courses such as the anti-inflammatory diet or pain management, all sorts of courses that will help guide you further in your journey to full foundation in integrative medicine. Some of the cool things about our education is it's on demand. So it's self-paced, it's delivered online, and you might be able to get continuing medical education depending on your institution or the country that you live in. Lastly, how do we engage with you? While it is online, there is a deep sense of community and faculty engagement. You're able to ask questions. There's a built-in dashboard. And again, these programs are ranging from a medical physician down to health professionals, medical residency, medical students. We even have courses that are for the lay public who have no healthcare background. So take advantage of this opportunity to get 20% off. Again, we're giving you a free course through environmental health. Go to the link here, and no promo code needed for environmental health, but for any of our other programs, check out promo code ILMC21 for a 20% discount. Thank you.
Thank you very much, University of Arizona, for your input. Mark Hyman's once said, "It is more important to understand imbalances in your body's basic system and restore balance rather than name the disease and match the pill to the ill." May I now request Professor Dr. Tahira Sadek, Public Health Specialist, Certified in Lifestyle Medicine, and Assistant Director, RIFA International Lifestyle Medicine, to come on stage and share the conference objectives with the audience.
Bismillahirrahmanirrahim. Assalamu alaikum, and I welcome you all to very first International Lifestyle Medicine Conference 2021. I am Professor Dr. Tahira Sadek, Assistant Director, RIFA Institute of Lifestyle Medicine. I feel privileged to be part of this scaffold laid down by none other than RIFA International University and Pakistan Association of Lifestyle Medicine. The vision and mission of this conference that we as a team wanted to accomplish is incomplete without the support of all that are present here in person and virtually with us. The conference aims and objectives are to introduce the evidence-based emerging specialty in healthcare community and medical students, to describe the role of lifestyle modifications in immunity enhancement, to demonstrate how specific evidence-based lifestyle changes can positively affect patients and improve health outcomes, to review the practice models and tools that can help lifestyle medicine physicians, practitioners, and professionals to assess, evaluate, prescribe, and counsel not only patients but their families as well. Multiple themes have been arranged around these objectives like preventive cardiology, science of happiness, lifestyle of youth, and definitely a lot of research articles. Rifa Institute of Lifestyle Medicine wish to set a trend toward healthy and happy living under the umbrella of lifestyle modification programs. Thank you very much for joining us here with zeal today. I would end by the saying of Thomas Edison, who more than 100 years ago in 1903 said that the doctor of the future will give no medicine, but will entrust these patients in the care of human frame, in diet, and in the cause of prevention of diseases. Thank you very much.
Very rightly quoted, ma'am. Thank you for your efforts. Galaxy of intellectuals, Your Excellency and distinguished guests, I am profusely elated to take an opportunity to invite none other than Mr. Hassan Muhammad Khan, Chancellor Rifa International University, chartered by Federal Government of Pakistan since its inception in 2002. He has done dual majors in industrial engineering and economics from Boston, USA, followed by masters in business administration. As an educationist of distinction, Mr. Hassan Muhammad Khan has played a pivotal role in establishment, development, and recognition of Institute of Rifa International University. He is the Chairman, Board of Governors, and Board of Trustees, Islamic International Medical College Trust. He is the frontline person in taking an initiative to establish a vision in creating and promoting the Department of Lifestyle Medicine in Rifa as a separate entity. Please welcome none other than Mr. Hassan Muhammad Khan.
Bismillahirrahmanirrahim. Honorable President of PMC, Dr. Rashid Taqi Sahab, respected Vice Chancellor, Health Services Academy, Honorable President of Pakistan National Heart Association, Honorable Board Members of Islamic International Medical College Trust and Rifa University, Dean Faculty of Medicine, General Arshad Sahab, Executive Director, IMC Trust, all the faculty members, luminaries, students, ladies and gentlemen, Assalamu alaikum. One of the key reasons, and I'll try to be rather brief, for Rifa to actually invest in and pioneer lifestyle medicine in the country by establishing Rifa Institute of Lifestyle Medicine under the very dynamic, very able leadership of Dr. Shugufta Feroz. I think it's a privilege for us, ma'am, that we have you to lead this initiative for Pakistan and for Rifa as well. I think, and I was talking to our deans, few weeks back, that lifestyle medicine is actually embedded in the DNA of Rifa International University. Our founding chancellor, General Zulfikar Ali Khan, who himself was a noted cardiologist, was one of the key founders of Pakistan National Heart Association. General Kiani could tell us more about PANA, but when PANA was established something like 30 to 40 years ago, so General Zulfikar, along with his respected colleagues, General Kiani Sahab, General Azhar as well from Armed Forces of Cardiology, and other PANA family members, would actually organize walks, meet the government officials, do a public awareness campaigns to ensure that, the general populace would, embed in their day-to-days a lifestyle change, which leads to a reduction on cardiovascular diseases. So PANAB, as the name would suggest, was more focused, of course, on cardiovascular diseases. And I was just looking at a WHO report the latest one, that last year there have been cardiovascular diseases has been the leading cause of death, causing 17.9 million people to die. That's almost paune 2 crore people along the globe. According to the International Diabetes Federation, and this was a very comprehensive report they did a couple of years back in 2019, approximately 463 million adults, that is people between 20 and 79 years of age, were living with diabetics. So 463 million, ladies and gentlemen, that's 46 crore. That's twice the population, more than twice the population of Pakistan. Diabetes caused about 4.2 million deaths in 2019. When you look at the incidence of cancer and other NCDs, non-communicable diseases, you'll see that globally, 72% of deaths are caused because of NCDs. So I don't want to start the morning by scaring all of the people here, but that's more than 70% chance that you and I will die because of an NCD, right? And of course, being Muslims, we believe, zindagi aur maut Allah Ta'ala ke haath mein hai aur usne ek din muqarrar rakha hua hai. But Allah Ta'ala has given us, freedom to choose as well. We can make decisions about our lifestyle. All these NCDs are actually not only preventable, but once you've had it, they are reversible. Unfortunately, most of the NCDs, and I'm not a medical doctor, and I certainly do not mean to offend any of the leading medical professionals here. My father, the founding chancellor, being one of them, so I have the utmost respect. But the fact is, what I've seen, I've seen this for the last good about 30 years of my life since I, got educated and all, and I grew up. If you have a blood pressure, hypertensive condition, the physician is going to give you, a medicine, subah sham ye goli khao, or zindagi bhar khao. So you go, you've got a problem with your cholesterol, you go to, sir, I hope I'm not offending anybody. आप ये तो इतने मेरे elders हैं कि मेरे कान पकड़ ले तो मैं उफ नहीं कर सकता, right? But the fact is, they're going to give you a cholesterol lowering drug, and then you'll have to take it the rest of your life. If you have diabetes, modern medicine, you go to any hospital, including, unfortunately, one of our teaching hospitals, you go, and more than likely, I'm not saying all doctors do that. There are people who, especially those who are more aware of lifestyle factors, wouldn't, approach patients that way. But perhaps most of the practitioners for management of diabetics are again, design an allopathic medicinal intervention for you. And all these interventions, they just manage the disease. They do not cure. Strangely speaking, I was again looking at the data. In United States, 86% of the healthcare budget, which is 10 times more than the budget of Pakistan, they're spending 18% of their GDP on healthcare. And by 2045, they're expected to spend 20% of GDP in their healthcare. In Pakistan, we are spending, I don't know, I think 2% was the figure I looked when I last checked, right? 2%, Professor, right? 1 point. So less than 2%. So here is United States of America with the finest of healthcare systems, the cutting edge hospitals, the best healthcare professionals and paramedics and consultants, right? And spending so much money. And what's happening there? More than 80% of the budget goes to manage patients with NCDs. And they can't do it every US, I mean, I was educated in America, and as an undergraduate back in the 80s, since the last election between Mr. Trump and Mr. Joe Biden, the critical campaign issue that is discussed in American politics today is, what is going to be the strategy of Democrats or, versus Republicans on how to manage healthcare. You look at the National Health Services, NHS of United Kingdom, it's absolutely in a mess. I don't want to go into the details of figures, facts and figures, but they cannot manage the healthcare burden. And I believe the only way to deal with this issue in Pakistan, and there is no other way, is that we as a nation, RIFA as an institution, you as medical doctors, students, our regulators, PMCs here, Honorable Vice Chancellor, Healthcare Services Academy is here. I believe we'll have the Federal Minister on Health would also be joining us vis-a-vis video link during the course of today's proceedings as well, is that we have to change the paradigm of how we treat our patients. And I believe the only logical, only cost-efficient, cost-effective method is to actually invest in developing professionals who are actually trained in lifestyle medicine. Now, lifestyle medicine has evolved, I think, over decades now, and now it's a very mainstream and evidence-based, research-based field. It's not an issue of totkas. थोड़ा सा शहद खा लिया करें भाई, आपका ये हो जाएगा, लहसुन की कंकॉक्शन आप बना लें, कोलेस्ट्रॉल कम हो जाएगा, सुबह 4 कदम चल रहे हैं. It's not about that. It's a scientific field. 2018, and I was surprised to see that, and I don't want to again take too much of your time. British Medical Journal, one of the most prestigious, journals of medicine, Madam had a full feature. I don't know whether you probably went through it. Full feature on lifestyle medicine with Professor Rob Lawson as a main contributor, and he'll also be joining us today via video link, who's a founding president of the British Lifestyle Society, and also, I believe, the president of the European Lifestyle Society now as well. A couple of years back, actually 1 year back, 2020, I got in touch with the then president of AMI, Association of Medical Education in Europe, which is the oldest, the largest, and the most prestigious network of medical educationists in the world. And they have a conference, in one of the European cities every year. And I requested them that they need to put lifestyle medicine on their agenda. And it was a privilege given to RIFA University, an honor for, I believe, for Dr. Shagufta, and a privilege for me as well, and quite undeservedly so, if I may admit, because I chaired the first session, which was a complete symposia, which was organized on the platform of AMI 1 year back. And of course, Dr. Saba was one of the keynote speakers. We had Rob Lawson joining us as well. So now there is a huge movement. I had a case study I was looking at last night, Baylor School of Medicine, it's a very leading school of medicine in the United States. They have integrated lifestyle medicine into their curriculum, not only for their medical students, but also for residents as well for the last two years. And I'm extremely proud and happy to report to this August forum, to the president of PMC as well, sir. And I think, I'll make a special request to you today as well, that the team at RIFA University, under our very able and dynamic leadership of course, our Dean Faculty of Medicine, other faculty members, Dr. Shagufta, of course, our rare RIFA Academy for Research and Education. So whole group is sitting together, and they've been working for the last almost, I think, 6 to 9 months to set up a curriculum which would be integrated in our MBBS program. And then we will integrate it in all our health professionals program. So I think the dean was very concerned that PMC kya kahegi. So sir, I don't know with due respect, मैंने कहा जो मर्जी का है आप ही इसको तो integrate करें. So my very humble request to PMC, to the all the concerned people is that and we're willing to, of course, it will be our privilege to share our expertise with PMC to other regulator, and we are willing to share this curriculum. And I believe one of the way forward is to actually integrate this curriculum at undergraduate level in our pharmacy program, and our dental program, and in our rehab programs, and of course in our School of Medicine. So I believe, and the Honorable Dean has promised me that inshallah, starting January or February, when our next sessions come, would join us, IMC will become the first medical school in Pakistan, perhaps in Asia, to have an integrated lifestyle medicine curriculum embedded in the syllabus of MBBS. I'm also very happy to report that over the last year or so, and I think kudos to our senior faculty members from our School of Medicine and other programs as well, who have gone through the certification of lifestyle medicine. So now we've got, assistant professors, associate professors in different domains who have an additional qualification in lifestyle medicine as well. And like Dr. Shagufta just said, that we've had the privilege of now hosting the lifestyle board examination being offered first time in Pakistan as well, in collaboration with the Pakistan Association of Lifestyle Medicine. I think it's going to be held in Mizan. Mein aap kar rahe hain? Kahan kar rahe hain? Remote kar rahe hain usko. So in any case, because of Corona, ultimately it's going to be probably on-prem as well. We've also offered a preparatory course for the participants, or those people who are desirous of taking the examination. So, at the end of the day, again, I would request PMC to kindly send you a written formal proposal, and so to debate, and hopefully, at your executive level, look at the possibility of making it as as an integrated part of our medical curriculum, a part for the students, I say, which must be assessed as well. क्योंकि इम्तिहान अगर जिस चीज का ना लिया जाए तो फिर हम आई थिंक उसकी तरफ तवज्जो कम करते हैं. सो वो पास एंड फेल की कसौटी के ऊपर आई थिंक इसको इंटीग्रेट होना चाहिए, और जो हम कर रहे हैं. वंस अगेन आई एम सो ग्रेटफुल टू द President PMC, to all the guests of honors, to the faculty members, deans, directors, students, faculty members, participants, for being here with us today. Thank you very much.
Thank you very much, sir. We are grateful for the patronage you have shown over the years, and we wish for your continued support in future as well. Ladies and gentlemen, to grace this occasion, we have with us through video message Dr. Faisal Sultan, Pakistan infectious disease physician, appointed as the Special Assistant to Prime Minister Imran Khan on National Health Services in August 2020. He's Prime Minister focal person on COVID-19 regulation and coordination as well. He has served as Chief Executive Officer of Shaukat Khana Memorial Cancer Hospital and Research Center from 2003 to 2020. Let's listen to Dr. Faisal Sultan.
I'm delighted to learn that the Pakistan Association of Lifestyle Medicine, PALM, in collaboration with the Rifa University Institute of Lifestyle Medicine, is organizing the International Lifestyle Medicine Conference in 2021. In addition to taking care of our physical health, we also need to pay close attention to nutrition, to exercise, and our environment to stay healthy. We need to integrate mental health into our physical well-being to improve our overall well-being. Lifestyle medicine can play an important role in enhancing our immunity and in supporting sustainable healthcare in Pakistan. We can treat and prevent chronic conditions by addressing some of the underlying behaviors and social and environmental drivers of some of these diseases. Unhealthy lifestyles lead to chronic diseases in many circumstances. By replacing these unhealthy activities and habits with positive ones, we can always treat and reverse many diseases. I do hope that we can work towards a holistic approach in patient care in Pakistan that incorporates some of these healthy lifestyle choices in their lives. I would like to congratulate Mr. Hassan Khan, Chancellor of the Rifa International University, and Dr. Shagufta Firoz, President of the Association of Lifestyle Medicine, and their teams for successfully organizing this conference. Thank you very much.
Grateful, sir, for joining us. Food is not just calories, it is information. It talks to your DNA and tell it what to do. The most powerful tool to change your health, environment, and entire world is your fork. Ladies and gentlemen, with immense exaltation, I would like to invite the prestigious guest of honors of today's session, Professor Dr. Shehzad Ali Khan. He is the Vice Chancellor, Professor and Dean, Health Services Academy, Islamabad, member of Academic Council, Quaid-e-Azam University. He has 28 years of public health-related work experience, ranging from peripheral level administration to management of tertiary care health facilities. He carries a vast teaching and research experience in the field of health financing, project management system and policy development, corporate governance, health economics, and quality management at national and international level as well. Please welcome Professor Dr. Shehzad Ali Khan.
मैं अपने साथ काफ़ी सारा डेटा याद करके आया था आज एनसीडीज का, वो सारे का सारा हसन साहब ने पढ़ दिया, तो मुझे अब खुद से कोई इम्प्रॉम्प्टो बोलना पड़ेगा. एंड मैंने देखे हैं स्टूडेंट्स, दे हेट स्टैटिस्टिक्स, सो आई विल नॉट टॉक अबाउट स्टैटिस्टिक्स. मुझे थोड़ा सा एंड आई एम हैप्पी दैट शगुफ्ता हैज टेकन अप दिस स्टेप एंड वी हैड अ डिस्कशन इन एचएसए एज वेल. थोड़ा सा इसको लाइफस्टाइल को ना, अगर हम स्टूडेंट्स की नजर से मैं बात करूंगा, क्योंकि मैंने देखा है फैकल्टी भी है, स्टूडेंट्स भी हैं, इसको थोड़ा सा पीछे लेके जाएं, बजाय इसके कि हम रेमेडीज की तरफ चले जाएं, नेचुरल और इंटीग्रेटिव मेडिसिन की बात करें. थोड़ा सा इसको लेके जाएं सोच के साथ. लाइफस्टाइल एक सोच है. सबसे पहले स्टूडेंट्स को, अपने फैकल्टी को, सबको ये समझाएं कि ये जो कुछ भी हम जिंदगी में करते हैं इसके पीछे एक सोच होती है. हमारे जो आबाओ अजदाद थे वो जो कुछ भी करते थे, अभी जब मैं ये लाइफस्टाइल की चीजें देखता हूं ना, तो मुझे अपनी दादी नानी और उनके, वो जो सर ने बिल्कुल सही कहा, टोटके याद आते हैं कि वो कितना क्लोज थे नेचर के. व्हाट इज लाइफस्टाइल मेडिसिन, व्हाट इज इंटीग्रेटिव मेडिसिन? इट इज क्लोज टू द नेचर, यूजिंग हर्बल एंड ऑल द रेमेडीज विच आर नॉट आर्टिफिशियल, नॉट केमिकल, नॉट बायोकेमिकल. सोच जो है वो हमारी आजकल नहीं बनाई जा रही. मुझे जो लगता है हमारे मेडिकल स्कूल्स में, हमारे एफएससी में, प्री मेड में, उसके बाद भी यूनिवर्सिटीज में, वी डोंट वर्क ऑन द थिंकिंग ऑफ द पीपल. हालांकि अगर लाइफस्टाइल आपने चेंज करना है तो असल चीज तो है ही हिट करना लोगों की सोच के ऊपर है. और जिस तरीके से हमारे यहाँ पे पाकिस्तान में खासतौर पे मैंने देखा है कि एक नेगेटिव सेल्फ टॉक जिसको कहते हैं आप, जो नेगेटिव थिंकिंग है, वो इतनी ज्यादा हो गई है कि गाड़ियां ज्यादा हैं लेकिन लोग फिर भी खुश नहीं हैं, पैसे जेब में ज्यादा हैं, पर्स भरे हुए हैं. हमारे पास तो पैसे ही नहीं होते थे, हमारे बच्चों के पास हमसे ज्यादा पैसे जितने हम उस वक्त हमारे वालिदैन कमाते थे उससे ज्यादा होते हैं. सो नेगेटिव सेल्फ टॉक इतनी ज्यादा हो गई है कि वो जो लाइफ स्टाइल है, जब आप नेगेटिव सोचते हैं, आप सब सोचें कि जब आप नेगेटिव सोचते हैं तो तब आपके अंदर चांसेस बढ़ जाते हैं नेगेटिव लाइफस्टाइल के बिहेवियर के. एडिक्ट कौन होता है? कौन ड्रिंक करता है? कौन हिट करता है? कौन डोमेस्टिक वायलेंस करता है? कौन जो है वो सबसे ज्यादा तंग करता है वालिदैन को या बहन भाइयों को या सबको? जिसकी नेगेटिव थिंकिंग होती है और किसी ना किसी फॉर्म में वो अपने आप को लूजर महसूस कर रहा होता है. तो जब हम पॉजिटिव सेल्फ बिलीफ को इनकलकेट करेंगे तो इंसान का दिल करेगा फिजिकल एक्टिविटी करने को, अच्छा खाने को, अच्छा बनने पे. तो वो जो एक बड़ा पुराना मेरा बड़ा फेवरेट है, मैं जब भी उसको पढ़ता हूँ तो मैं अपने स्टूडेंट्स को वो लाजमी सुनाता हूँ कि वॉच योर थॉट्स because your thoughts can become your words. Watch your words because your words can become your action. Watch your actions because your actions can become your habit. Watch your habit because your habit can become your character. And watch your character because your character can become your destiny. कहाँ से शुरू हुआ और किसने कहा था? हजरत अली रज़ी अल्लाह ने, हैदर करार ने ये बात की थी. और शुरू कहाँ से हुआ था? थॉट से. तो मेरा ख्याल है मैंने और मैं सर आपको भी ये कहूंगा, ऐसे तमाम असातिज़ा को और ऐसे तमाम एडमिनिस्ट्रेशन के लोगों को जो किसी किस्म की भी नेगेटिव बिलीफ फैलाते हैं आपकी क्लास में, उनको फौरन कैंपस से फारिग कर दें. मैंने अपने آپ امیجن کریں اپنے روزگار کی جگہ پہ کھڑا ہوا ہے, پبلک ہیلتھ کا ٹیچر ہے, آیا ہے اور اسے کہہ رہا ہے یار تسی ایویں کتھے آ گئے ہو, یہ تسی پبلک ہیلتھ کرن آ گئے ہو, تو نوکریاں ہی کوئی نہیں ساریاں, وہ گئیاں گلاں پرانیاں جڑیاں, وہ کچھ نہیں. وہ ساری کلاس میرے پاس آ گئی کہ سر ہمیں ٹیچر نے تو یہ کہا ہے. تو اگر آپ کے پاس ایک ڈی پی ٹی کا یا فارم ڈی کا اسٹوڈنٹ آتا ہے اور اسے آپ کا ٹیچر ایک کہہ دیتا ہے کہ نوکریاں ہی کوئی نہیں, تسی ایویں خام خواہ کی کرن آئے ہو تھے, تو اس کی جو تھنکنگ ہے وہ کس طرف جائے گی, اس کا لائف اسٹائل کدھر جائے گا. آپ کو 1.5 لاکھ روپے دے رہا ہے سیمیسٹر کا, کرایہ لگا کے آ رہا ہے, پتہ نہیں ماں باپ کیسے کما رہے ہیں, اور ہم ان کو نیگیٹو چیزیں پڑھا رہے ہیں. میرے کبھی ٹیچر نے کبھی یہ نہیں کہا تھا کہ تو نے ڈاکٹر نہیں بننا یا تو نے انجینئر نہیں بننا, انہوں نے کہا تھا جو تمہارا دل کرتا ہے نا وہ کرو زندگی میں, لیکن خوشی سے کرنا. So if you think you can do it and if you think you can't do it, you are right. Both ways. So it's all about the thought. So میرے خیال میں ہمیں سب سے زیادہ کام کرنا ہے اپنے اسٹوڈنٹس کی تھنکنگ کو پازیٹیو کرنے کے لیے, پازیٹیو سیلف بلیف ڈالنے کے لیے, اور ان کو اس قابل بنانے کے لیے کہ وہ اپنی زندگی کو کنٹرول کریں. اور کس طرح کنٹرول کریں؟ پازیٹیولی کنٹرول کریں. اگر ہم ایک پیسیمسٹ معاشرہ بنائیں گے جیسا کہ ہم نے بنا دیا ہے پیچھے اپنے, اور ہمارے سارے بچے مایوس ہیں, آپ میں سے میجورٹی کے بچے امریکہ جانا چاہتے ہیں, میرے اپنے بچے تیاری کر رہے ہیں کینیڈا کی, امریکہ کی, انگلینڈ کی, جی وہاں سے کرنا ہے پی ایچ ڈی, وہاں سے کرنی ہے ایم ایس. کیوں بھائی؟ میں نے پاکستان کے پبلک اسکول سے پڑھا ہے, پاکستان کے گورنمنٹ ڈگری کالج سے ایف ایس سی کی ہے, کنگ ایڈورڈ سے میڈیسن کی ہے, پی ایچ ڈی بھی پاکستان, سارا کچھ پاکستان میں کیا نا. ہیپی why I am not a pessimist person, because I found some very good teachers, some very good colleagues, some very good trainers who were positive, جن کو اسلام کا, پاکستان کا, مسلمان کا, بھائی چارے کا, فیملی کی ویلیوز کا پتا تھا. ہم نے اپنے بچوں کو صحیح ٹرین نہیں کیا. آپ اس کو میڈیسن کو ہٹا کے صرف لائف سٹائل پہ پہلے سوچیں. میری ریکویسٹ ہے کہ آپ سب سے پہلے لائف سٹائل پہ سوچیں. ڈونٹ ٹیک اٹ LSM, لائف سٹائل میڈیسن. ہم اس کو سوچیں لائف سٹائل, اور پھر اس کو میڈیسن کے طور پہ پیش کریں. جو ڈاکٹر شگفتہ کہہ رہی ہیں وہ یہ نہیں کہہ رہی کہ آپ نے یہ لائف سٹائل میڈیسن یوز کرنی ہے, وہ کہہ رہی ہیں کہ میں بھی یہی آپ سے ریکویسٹ کر رہا ہوں کہ فوکس کریں, تھوڑا سا پیچھے جائیں. سب سے پہلے تھاٹ پروسیس ٹھیک کریں اپنی نئی نسل کا. یہ ہم سے بہت ایڈوانسڈ ہیں, یہ آن لائن کورسز اور یہ چیزیں ہم سے زیادہ ایڈوانس پڑھ لیں گے. ان کی پازیٹیو سیلف بلیف ان کو واپس کریں, ان کو بتائیں کہ تم جو ہو نا وہ کرنا چاہتے ہو وہ کر سکتے ہو. اور اگر ہم یہ کرنے میں کامیاب ہو گئے اور تو مطلب میرا خیال ہے کہ فیوچر از سو برائٹ. میں آخری بات کروں گا کہ ہمارے یہاں پہ اکثر ہمارے ٹیچرز کا ایک بڑا خاص, ہمیں اپنے اوپر دیکھنا چاہیے, میں خود ان میں سے ہوں. ہمارا یہ ہوتا ہے کہ جی کس میں جاب اپرچونیٹیز زیادہ ہیں, کس میں. تو اسٹینفورڈ کے کسی ایک پروفیسر سے کسی نے پوچھا کہ جی آپ کے جو الومنائز ہیں, آپ کے جو یہاں سے گریجویٹس ہوتے ہیں, وہ زیادہ تر کن جگہوں پہ جا کے جاب کرتے ہیں؟ وہ ایسے کر کے دیکھتا ہے اس کو حیران ہو کے, اس کو کہتا ہے آر یو کریزی؟ At Stanford, we don't train people to seek jobs. We train people to create jobs. یہ رفا کا مشن ہونا چاہیے نا ان سے. اور میں نے یہ شروع کر دیا ہے پچھلے 1 سال سے. مجھے 4 مہینے ہوئے ہیں جی وائس چانسلر بنے ہوئے. میں پروفیسر ہی تھا, پڑھاتا تھا, لیکن میرے ذہن میں یہ ہوتا تھا کہ ان کو سمجھائیں انٹرپرینورشپ کیا ہوتی ہے, واٹ از انٹرپرینور. یہ جتنے لوگ یہاں بیٹھے ہیں نا, میں آپ کو یقین بتاتا ہوں کہ یہ سارے انٹرپرینور ہیں. حسن از این انٹرپرینور, جنرل جو ہمارے مسعود الرحمان کیانی صاحب انٹرپرینور ہیں, یہ سارے انٹرپرینور ہیں. یہ کون سے سسٹم ہے ہمارے ملک میں جس کے تھرو آپ ایک سسٹمیٹک طریقے سے بن کے اوپر آتے ہیں؟ کوئی سسٹم نہیں ہے. دیز آر آل انٹرپرینور جو یہاں بیٹھے ہوئے ہیں فرنٹ روز میں. اینڈ آئی وانٹ آل دا بیک بینچرز ٹو بی این انٹرپرینور اینڈ میک این آرگنائزیشن اینڈ ایکسل. ہمارے پاس تو کچھ ہے ہی نہیں. سب سے زیادہ ضرورت اس ملک کو ہے انٹرپرینورشپ کی. نہ ہیلتھ کی سروسز ہیں, نہ ایجوکیشن کی سروسز ہیں, نہ IT کی سروسز ہیں. کیا ہے ہمارے ملک میں؟ کیوں جاتے ہیں بھاگ کے امریکہ میں یا انگلینڈ میں؟ وہاں تو پھر بھی سسٹمز ہیں. جو پوٹینشیل یہاں پہ ہے انٹرپرینورشپ کا, دنیا کے کسی ملک میں نہیں. اور ابھی یہ 7 والے ملک میں آپ نے دیکھا جو ہوا ہے, افغانستان اور پورا فار ایسٹ, یہ ہمارے پاکستانیوں کے لیے اویلیبل ہے. میں آپ کو بتا رہا ہوں, یہ ہم نے جا کے وہاں پہ ساری سروسز دینی ہے. تھینک So, and last thing, madam, if you want to create a board or any partnership in Pakistan on lifestyle, Health Services Academy will be the first to sign it. ٹھیک ہے, ہم آپ کے ساتھ اس بورڈ میں شامل ہوں گے. Thank you very much.
Thank you very much, sir, for your eminent talk. August gathering, we have with us today virtually Dr. Rob Lawson, Chairman and Founder, British Society of Lifestyle Medicine, Chair of World Lifestyle Medicine Council, President of European Lifestyle Medicine Council, founder of charity program for providing rehabilitation for sufferers of chronic conditions, such as heart diseases, type 2 diabetes, stroke, frailty, and lung disease. Dr. Rob Lawson.
Well, hello everyone from a chilly day and the COP26 hosts in Scotland. My name is Rob Lawson, Chair of the British Society of Lifestyle Medicine and Chair of the World Lifestyle Medicine Council. Thank you, Dr. Shagufa Feroz and the officers of the Pakistan Association of Lifestyle Medicine for this invitation to say a few words in honor of our inaugural international conference in 2021. In recent times, the spotlight has been shone on the health of our respective nations, and the true scale of our determinants of ill health is being exposed to a wider audience and even to our governments. The COVID pandemic is shocking, not only for the bereaved and infected, but to a lesser degree by every citizen in our countries. We mustn't walk out of this pandemic unchanged. At an individual level, community level, societal level, we have to make hard choices and accept that in this Anthropocene era, mankind has created the conditions for this perfect storm of acute and chronic disease. We have presided over the degradation of our individual and planetary health, and we're exposing our children socioeconomically and environmentally to the prospect of a lesser healthy lifespan than their parents. So it is really the time for nudging that hashtag one change at a time. As Professor Gary Egger told us in a recent broadcast, whereas education and motivation are key factors, regulation and legislation must surely follow. Now, we don't practice lifestyle medicine for fame and fortune. It's not alternative, and there's nothing whatsoever to do with apportioning individual blame. People are people, not conditions, and are not being judged. It is us who have created this unhealthy environment, for some more than others. We must now uncreate it. Lifestyle medicine is rooted in science. Almost every guideline tells us this, and applying its principles is key to our future global health. Another part of the solution lies within our own societies. The Pakistan Association of Lifestyle Medicine is showing leadership in your country and is to be applauded for that. In the British Society of Lifestyle Medicine, we have a community and network of supportive individuals who really care, who want to make a difference, who want to bring change to bear. It provides educational opportunities which help to remove barriers to change, most of which are related to confidence and perceived competence amongst healthcare workers. These educational opportunities do include certification from the International Board of Lifestyle Medicine and the best of luck to all the candidates at this year's exam. The development of our BSLM Learning Academy is a current priority and is gaining fast momentum, such that we will be opening up quality content early in 2022. So together, the World Lifestyle Medicine community will be the driver for change, which will turn the tide of avoidable premature death and the non-communicable diseases lapping on our shores and at our borders. And thereby, we will mitigate the damage of any future inevitable syndemic. At World Lifestyle Medicine Council level, our vision statement is this: a world where all citizens can achieve optimal health in an equitable world without non-communicable disease. Ladies and gentlemen, I've shown no slides, no graphs, quoted no statistics, and used only the spoken word. But the message is clear. In the midst of the rising global burden of disease, together we can make a difference. We can address what really matters to our patients and our citizens. And so I finish by congratulating PALM for your inaugural conference and all the delegates for having the wisdom to participate in a very important development in your country. And I'm sure you'll be inspired. Wishing you all well and take care. Thank you and have fun.
Thank you, sir, for joining us. Ladies and gentlemen, let me have the privilege to invite our next prestigious guest of honor, currently working as President, Pakistan National Heart Association, known as PANA, Chairman, PANA Trust, Director and Cardiac Surgeon, Hearts International Hospital, Rawalpindi. He is the member of Society of Thoracic Surgeons, USA, and Society of Cardiac Surgeons, Asia Pacific. He is very well regarded former Commandant AFIC and IHD Rawalpindi, Honorary Surgeon of President of Pakistan, President Pakistan Cardiac Society, President Association of Cardiothoracic and Vascular Surgeons of Pakistan, Professor of Cardiac Surgery, Vice President College of Physician and Surgeon Pakistan, Vice President SAR Cardiac Society. He has been awarded with Halal Imtiaz Military, Satara Imtiaz Military and Tamgai Basalat as well. Please welcome on stage Major General Retired Dr. Masood Rahman Khani.
Bismillah ar-Rahman ar-Rahim. Nahmaduhu wa nusalli ala Rasulil Kareem. Learned Professor Taqi, Chancellor Rifa University, Hassan Muhammad Khan, Professor Shahzad, General Azhar, General Wasim, professors, members of the academia, students, ladies and gentlemen, Assalamu alaikum. मुख्तसर सी बात करूंगा कि जो रवायात हम तक पहुंची हैं उनमें से एक ये भी है कि इल्म व हिकमत मोमन की गुमशुदा मीरास है। अगर इसको थोड़ा सा आगे बढ़ाएं तो ये भी बिल्कुल सच है कि एक अच्छी जिंदगी जीना या एक ऐसी लाइफस्टाइल अपनाना जिससे आपकी सेहतमंद और खुशी वाली जिंदगी जी सके, वो भी हमारी गुमशुदा मीरास है। We don't have to invent the wheel again. जैसा कि आप पहले स्पीकर्स को सुन चुके हैं, ये प्रैक्टिस की जाती रही है सदियों से हमारे यहाँ। हम इसे भूल चुके हैं और छोड़ चुके हैं। जब खुदावंद ताला ने हजरत आदम को पैदा किया, उसको खलीफा बना के भेजा इस दुनिया में अपना, और इसके ऊपर ये जिम्मेवारी दी कि आप अपना ख्याल रखेंगे, सबसे पहले अपने इर्द गिर्द का ख्याल रखेंगे, नियर एंड डियर वंस का, रिश्तेदारों का, लोगों का, सोसाइटी का, मुल्क का और दुनिया का एज अ होल। और इसके साथ साथ ये जो दुनिया है कुराए अर्ज, इसका भी ख्याल रखना उस खलीफातुल अर्ज की जिम्मेवारी में शामिल था। हमने क्या किया कि सब कुछ भूल गए। एक सेहतमंद जिंदगी खुदावंद ताला की तरफ से एक तोहफा है हमारे लिए, एक नेमत है उनकी तरफ से। अपनी तौर पे अपनी जिंदगी को अगर हम सेहतमंद बनाने से अपनी ही गलतियों से दूर कर रहे हैं तो ये कुफरान नेमत है। फर्स्ट ऑफ ऑल वी हैव टू लुक आफ्टर आवर हेल्थ so that we are able to fulfill the purpose of life. कि जिंदगी का मकसद क्या है। साफ लफ्जों में हमें बता दिया गया है कि जिंदगी का मकसद खुदावंद ताला की इबादत करना है। इसको भी हम शायद ये समझे कि हज, रोजा, नमाज, ज़कात, ईमान इबादत में काफी है। बेशक ये इबादत का बहुत अहम हिस्सा है, लेकिन एक थोड़ा हिस्सा है। इसके साथ साथ इखलाकियात, मुआमलात, हुकूकुल इबाद और अपनी इन्वायरमेंट के कुर्राए अर्ज के आपके ऊपर जो हुकूक हैं वो भी इबादत का हिस्सा है। हम सब कुछ भूल चुके हैं। वी हैव टू उसको हमें ढूंढना पड़ेगा और अपनाना पड़ेगा। पाकिस्तान नेशनल हार्ट एसोसिएशन, जिसको पनाह भी कहते हैं, फर्स्ट चांसलर ऑफ दिस यूनिवर्सिटी, जन जुल्फ़िकार अली खान ने आज से तकरीबन 4 दिहाइयां होने वाली हैं शुरू की थी, ताकि लोगों में बढ़ती हुई दिल की बीमारियों को रोकने के लिए जो मॉडिफाइबल रिस्क फैक्टर फॉर कार्डियक डिजीजेस हैं उनको लोगों को समझाएं और उनको मॉडिफाई करने की कोशिश करें ताकि दिल की बीमारियां कम हो सकें। फॉर्चुनेटली ये वही फैक्टर्स हैं जो एक अच्छी जिंदगी गुजारने के उसूलों के ऐन मुताबिक हैं, यानी लाइफस्टाइल, अच्छी लाइफस्टाइल गुजारने के लिए हैं। जैसा कि कहा जा चुका कि लाइफस्टाइल में जो मेडिसिन का लफ्ज है उसका मतलब ये नहीं कि आप गोलियां और मिक्सचर्स बांटते फिरें लोगों को। वक्त मुख्तसर है, मैं मुबारकबाद देता हूं रिफा यूनिवर्सिटी को डॉक्टर हसन की ज़ेर साया कि इन्होंने एक ऐसे मौजू को चुना और उसको अपनाया और डॉक्टर शगुफ्ता को लाहौर से उठा के इधर लेके आए, ताकि, और हम बहुत फॉर्चुनेट अपने आप को समझते हैं इस इलाके के लोग और इस यूनिवर्सिटी से जिन लोगों का भी वास्ता है थोड़ा बहुत या ज्यादा, कि एक ऐसा सब्जेक्ट हमें सिखाया जा रहा है जिसकी अशद जरूरत है। अनफॉर्चुनेटली, जैसा कि पहले कहा गया, प्रिवेंटिव मेडिसिन, प्रिवेंटिव कार्डियोलॉजी और लाइफस्टाइल का जो सब्जेक्ट है ये ऐसा, इसमें ये इंसेंटिव ड्रिवन और कैरियर ड्रिवन मजमून नहीं है, इसलिए इसके ऊपर बहुत या बिल्कुल ही ध्यान नहीं दिया जाता। अंडर ग्रेजुएट लेवल पे, पोस्ट ग्रेजुएट लेवल पे और हमारे जितने मेडिकल इंस्टीट्यूशंस हैं पाकिस्तान में, किसी में भी इसके ऊपर इतना ध्यान नहीं दिया जाता जितना ये डिजर्व करती है। और यही एक वाहिद तरीका है पाकिस्तान के लोगों में जो हेल्थ, जो डिजीज बर्डन है, बहुत कम्युनिकेबल एंड नॉन कम्युनिकेबल डिजीजेस का, उसको कम करने का, पाकिस्तान के ऊपर जो हेल्थ स्पेंडिंग है उसको जुडिशियसली इस्तेमाल करने का जो पहले ही बहुत मीगर है, 2% से भी कम है जैसा कि बताया गया। बात को ख़त्म करते हुए मैं डॉक्टर शगुफ्ता को और डॉक्टर हसन साहब को ये बावर करवाना चाहता हूं कि पाकिस्तान नेशनल हार्ट एसोसिएशन अंडर द अम्ब्रेला ऑफ रिफा यूनिवर्सिटी हेल्थ लाइफस्टाइल मेडिसिन की जो इनिशिएटर्स हैं, जो प्रोफेसर हैं, उनके साथ मिलके हम एक पार्टनरशिप करना चाहते हैं। जैसे कि डॉक्टर शहजाद ने कहा कि लेट्स स्ट्राइव together to formulate a methodology to popularize this subject in our medical profession. Thank you very much.
Thank you, sir. As per global standards, Pakistan is facing shortage of 0.2 million doctors, 0.18 millions of dentists, and 1.4 millions of nurses, resulting into increased workload per doctor, leading towards physicians' burnout and stress. Pillars of happiness and emotional well-being are positive emotions, engagement in present moment, relationships, meaning in life, accomplishments. And techniques for self-management for stress include mindfulness, abdominal breathing, volunteering for meaningful cause, time in nature, and to get involved in real life. Let's attenuate our stress with some breathing exercise. We request all of you to please join us. Please sit comfortably. Empty your lungs of all the air in. Now breathe in quietly through your nose for 4 seconds. 1, 2, 3, and 4. Hold your breath for a count of 7 seconds. 1, 2, 3, 4, 5, 6, 7. Exhale forcefully through your mouth, pursing your lips, making a whoosh sound for 5 seconds. 1, 2, 3, 4, 5. Managing your stress is a very important pillar of lifestyle medicine. Thank you so much.
Ladies and gentlemen, may I now request the esteemed, the distinguished, the illustrious, and renowned personality who does not need any introduction. He is President, Pakistan Medical Commission. He is a consultant anesthesiologist and has vast experience in critical care, teaching training, and healthcare registration. He has also contributed to critical care and teaching training as a founding member of the Faculty of Critical Care Medicine. He specialized in preoperative care, developing comprehensive anesthetic plans, and in administering anesthesia. During the course of his career, that spans over 4 decades, he has been instrumental in training fresh graduates and creating opportunities for learning for consultants in the field of anesthesia in Pakistan. As president of Pakistan Medical Commission, he oversees the organization's role in regulating healthcare education in the country. Under his leadership, the organization has achieved various milestones in a short span of 1 year. Under his supervision, PMC also achieved the digitization and automation of the online licensing and verification application system. He is none other than the President of Pakistan Medical Commission and our honorable chief guest of today, Professor Dr. Azhar Taqi.
Thank you very much. Bismillahirrahmanirrahim. I'm honored, and I am not exactly what they said. I'm just an ordinary doctor. General Azhar Rashid called me a little while back and said, "तुमने आना है और आके हमारे conference में join करनी है. हुक्म आपका." I can never say no to General Azhar Rashid. Thank you. So, the Honorable Chancellor, Jan Kiani, Dr. Shehzad, friends, ladies and gentlemen, it's a privilege to be here. And particularly because this is an initiative that was kind of, we were waiting for that. That was far overdue. I thought I'd talk in English, but बात बनती नहीं है. जलकियानी ने भी प्रेसिडेंट सेट किया, शहजाद साहब ने ऑफ कोर्स बहुत सारे दरिया कूजे में समोए, तो वो it's something because when we talk about lifestyle medicine, actually we are talking to the masses. हम यहाँ आपस में तो बात कर रहे हैं, but hopefully ये masses में भी जा रहे हैं. ये कुछ मैं देख रहा, I have a little interest in reading history, और वो हर उल्टी सीधी चीजें आप पढ़ते पढ़ते आप देखते हो केवमैन की कहानी सुनते थे, हंटर गैदरर होते थे, they lived good lives. फिर उसके बाद एग्रीकल्चर आ गई और masses को फीड करने के लिए obviously grains आ गई, and with grains came that consumption of carbohydrate. The interesting thing was कि जब उस जमाने के लोगों को उन्होंने देखा, तो that was the first time that you started looking at evidence of teeth decay. So dental decay aani shuru hui. And suddenly with that, besides other things, that dental decay was actually contributing to low life expectancies in that time. 30-35 साल की उम्र में दांत खत्म हो जाते थे, अब चबाया कुछ जाता नहीं था. So they would actually die of starvations and diseases. That's some evidence coming from archaeology and all that. इंटरेस्टिंग बात यह है कि ये चलता रहा, और इवन मेडिवल ये इंडस्ट्रियल इंग्लैंड में जब वहाँ के आप 200 साल पहले के लोग देखेंगे तो डेंटल डीके एंड वंस अगेन शॉर्ट लाइफ एक्सपेक्टेंसी. फिर कोई आया, उसने आके दांत साफ करने का तरीका निकाल दिया, टूथपेस्ट आ गया, एंड सडनली द टीथ स्टार्टेड गेटिंग बेटर. आई एम नॉट ट्राइंग टू गेट द डेंटिस्ट आउट ऑफ जॉब्स, लेकिन वाकई अगर दांत साफ रखें तो इनकी जरूरत कम पड़ती है. But anyway, ये एक छोटा सा इशू अभी इसी में आया था, तो उसको मैं I am giving me my thoughts on that, कि जब हम कहते हैं कि जी मौत का एक दिन लिखा होता है हर शख्स का, और हम सबका ईमान है, बिलीफ है, और इसकी वजह से हम कहते हैं कि जी जो मर्जी कर लो. And on the lighter side, there's this फ्रेंड ऑफ माइन वो जिसके जो सुनाते होते थे कहानी के जी मेरा एक आगे से और दोस्त था और उसका एक छोटा भाई था वो वाज वेरी केयरलेस इन लाइफ so we hadn't met for some time. We met up about 20 years. तो मैंने उससे पूछा सब हाल चाल वो भाई का क्या हाल है उसने कहा जी फौत हो गया डायबिटिक भी था हाइपरटेंसिव भी था हार्ट डिजीज भी थी तो मैंने कहा यार हाँ यार वो अपना ध्यान भी तो नहीं करता था खाना उल्टा सीधा खाना हर चीज तो उसने कहा नहीं वो सरगोदा से लाहौर आ रहा था बस का एक्सीडेंट हुआ फौत हो गया so all that so he lived to enjoy but the point is that we tend to think like that when we're being careless with our lifestyles क्या फर्क पड़ता है मौत का एक दिन तो आना है इसका the way I think about it is कि जब अल्लाह ताला आपको एड्रेस कर रहा होता है तो वो अशखास को नहीं बाज़ का सोसाइटीज को एड्रेस कर तुम लोग जो करोगे तुम्हें उसका नतीजा मिलेगा these interventions that we make may not change the destiny of an individual may still die of heart attack or for any other cause at a young age but if you look at the collective statistics in the societies the destinies of the societies change due to the interventions that they make so अपने लिए नहीं अपने बच्चों के लिए आसपास वालों के लिए we should accept that what is good for society ये lifestyle interventions जो है ये matter करती हैं और इससे actually life expectancies भी change होती हैं and data and after has shown that हम देख रहे हैं there was this reference to diabetes increasing incidence to diabetes सबसे interesting बात ये है और and that's the most funny thing that I was laughing about a few days ago and I keep on laughing about कि शोर मचा होता है चीनी की कीमत 135 रुपए हो गई गजब हो गया for God's for heaven's sake इसको 835 पे जाने दो you need to drastically cut your sugar consumption Jankyani is sitting there Azhar is sitting there I mean why are you mourning an increase in the price of sugar I come from a farming background as well and let me pass a political statement hope I am not crucified for that there is enough reason for me to be crucified so this would be another one कि वो कहते हैं कि जी this sugarcane and sugarcane related industry has actually played havoc with our agriculture my father used to be a cotton farmer अब हम गन्ना लगाते so the cotton crop in the entire south of Punjab is gone. But anyway, that's another area. But sugar control, diabetes, those are those things that we need. The value of exercise. Once again, my grandchild actually is a fantastic cricket player on the screen. So what's the point? I would play I'd still go and play in the field. So coming back to our profession, this is a wonderful initiative and I'm coming to that in a minute. मैं ये देखता हूँ डॉक्टर बहुत अच्छे डॉक्टर हैं बहुत ज़बरदस्त डॉक्टर प्रोड्यूस किए हैं individually and I must say every one of us has gone through an extremely challenging time in our life, challenging careers in very competitive environments, done our best, given our best. बहुत अच्छा. But जब आप हटके मेडिकल प्रोफेशन को एज अ प्रोफेशन सोचते हैं तो एक जो चीज हमें देखनी पड़ेगी कि कलेक्टिवली हमारा काम था टू प्रोवाइड द बेस्ट पॉसिबल हेल्थ केयर विद इन द गिवन रिसोर्सेज टू द सोसाइटी. हैव वी सक्सीडेड इन दैट और हैव वी इवन थॉट ऑफ ट्राइंग अबाउट दैट? हम जो गिवन रिसोर्स हम वे मॉर्निंग 2% of the GDP spent on healthcare or the budget spent on healthcare. Yes, that is kind of pitifully low. But what if we were not spending that much on therapeutics and spending a little more efforts and energies on actually preventing diseases? So, जो meager resources थी उसकी resource allocation के लिए And if we look at the qualities of a good doctor, आप CanMeds उठा के देख लें, आप ACGME के दिखा के देख लें, जितने भी एक quality of good doctors हैं, उनके अंदर एक health advocate वाला component आता है. So are we ever also focusing on our job as health advocates? probably that's an area where we need to do. बहुत बड़ा काम इनिशिएटिव लिया आपने, Dr. Wonderful, fantastic. But now, welcome to the world of disappointments. जब आप, when you try to stir things up, you will get people out of their comfort zones. You will also be stepping on a few toes. क्योंकि जब आप बार बार कहेंगे कि जल साहब आप तो जी दवाइयां लिख के दे देते हैं, तो कोई ना कोई तो नाराज होगा. Jal Saab is a very magnanimous. These people are there, they're great people, but there are some people who are not going to be very happy with. You're constantly advocating कि यार दवाइयां कम करो. और उसमें I can actually, I have empathy, I can relate to that, because I understand when you try to bring in change and try to get people out of their comfort zones, they don't like it. But I would say, great work, sir. Carry on. और इंशाल्लाह अल्लाह ताला आपके साथ होगा. आपने you brought up this issue of undergraduate curriculum, and so उसमें मैं अपनी thought जो current पाकिस्तान Medical Commission की एक thought है, the council agrees, the board is on, we are on the same page on this one, कि पाकिस्तान Medical Curriculum Commission के jobs में एक है to define the curriculum, but then university का काम भी तो curriculum देना है. कॉलेज ही उसकी इंस्ट्रक्शनल स्ट्रेटजीज देता है, उसका एक कंपोनेंट देख रहा होता है. सो व्हाट आर दोस बाउंड्रीज? और हमारा ख्याल है कि पाकिस्तान मेडिकल कमीशन को इसमें बहुत ज्यादा प्रिस्क्रिप्टिव नहीं होना चाहिए, और वो चीज इंशाल्लाह जो आगे करिकुलम आ रहा है उसमें उसके अंदर ये रिफ्लेक्ट करेगी. इट्स नॉट आवर जॉब टू प्रिस्क्राइब टू यू कि आप, आवर प्राइमरी जॉब इज टू टेल यू व्हाट काइंड ऑफ अ डॉक्टर वी वांट फ्रॉम यू. सो द यूनिवर्सिटी then has to find a way. हम इसके अंदर कहते हैं कि when in the process of producing that good doctor that we have defined, these are the certain things that we think need to be taught, and then you should have the freedom to decide कि आप कैसे पढ़ाना चाहते हैं. Second, you should have the freedom to decide, और हम भी के उनको इतना स्पेस दे दो यूनिवर्सिटी की कि अगर वो स्टूडेंट को थोड़ा सा रूमी या सादी या बुल्ले शाह पढ़ाना चाहते हैं तो वो भी पढ़ा लें, बिकॉज यू आर नॉट जस्ट प्रोड्यूसिंग पीपल हु बी राइटिंग प्रिस्क्रिप्शंस, यू वांट टू हैव पीपल who are actually going on and interacting with patients and managing them. Time thoda hai, I don't want to come stand between you and actual knowledge. But यहाँ जिक्र हुआ था ये work job stress का. I have a little bit of an interest in that. We published a little. और उसके अंदर हमने देखा कि burnout, और मेरी specialty में खास तौर पे लोगों में burnout बहुत होता है, और उस पे कुछ हमने publish किया, कुछ देखा. And what I'm looking at and what I'm trying to look at probably for the future project is a connection between sense of empowerment and burnout. वो जो एक disempowerment की feeling होती है उसका बहुत ज़्यादा stress और burnout के साथ ताल्लुक होता है. But empowerment जो है वो एक mental construct है. हमारा ख्याल है कि empowerment का मतलब ये है कि मुझे खुली छुट्टी दे दो, जो मैं मर्जी करूं तो then I'll be empowered. That empowerment is not that. Empowerment is a mental construct. और उसका एक fundamental उसके अंदर चीज होती है कि if something has gone wrong, then am I blaming, is the locus of control internal or external? Am I going to blame my effort for it or some external factors for it? An empowered person would tend to say, okay, I could have done better and this is what I should do better to get a better outcome. We need to train our people, our students, into this sense of empowerment as well. Lot to say, but I had heard a lot about RIFA being one of those universities which are pioneering in medical education. Now you've got chosen another field where you are going to be pioneers. Please keep it up. Well done, sir. Thank you.
Grateful, sir, for your joyful and eminent talk. Ladies and gentlemen, may I now request the Honorable Chief Guest, to come forward to present souvenirs to our esteemed guests of today's session. I also request Dr. Shagufta Feroz to accompany the chief guest. May I have the guest of honor, Professor Dr. Shahzad Ali Khan, to achieve his souvenir. I request the guest of honor, Major General retired Masoodur Rahman Kiani, to come forward for his souvenir. May I have the Vice Chancellor, Professor Dr. Anis Ahmed, to come forward. He is not present right here. I request the Chancellor, Mr. Hassan Mohammed Khan, to come and receive the souvenir, please. May I now request the Chancellor, Mr. Hassan Mohammed Khan, to present souvenir to our chief guest, Professor Dr. Arshad Taki. Thank you very much. From this day forward, let us make each decision with best interest in mind. Let us be the best that we can be so that we may fulfill our lives and lives of those closest to us with happiness and with pride. We have already taken the first and foremost step by making it to this occasion today. Now it's time to take the next steps in the journey that is our lives and to begin our futures. The distinguished guests are requested to proceed for the group photograph. Thank you very much for making this session a memorable one. Take good care of yourself. Allah Hafiz.